Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Chinmoy Mazumdar, and today we are delving into a silent epidemic that India is combating, that is heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of the elderly. Let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means that your heart is struggling to pump blood as efficiently as it should. The ejection fraction, or EF, measures how well your heart pumps blood. It is the amount of blood that pumped out of your heart's lower chambers, that is ventricles, each time it contracts. While a normal ejection fraction is around 50 to 70%, individuals with heart failure typically will have an EF of around 40% or lower. Secondly, why are so many Indians affected by heart failure? Genetics play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits worsen this epidemic. Moving on, what are the signs and symptoms of heart failure? We should watch out for confusion, fatigue, palpitations, nausea, shortness of breath, and weakness. There is also loss of appetite and vomiting. How can we protect ourselves from this disease? Our heart works incredibly hard to keep us alive. These are 5 golden rules we can follow to return the favor. Early detection of heart failure through regular blood tests, dietary adjustments to maintain heart health, incorporating daily exercise into your routine, practicing stress management techniques, quitting alcohol, tobacco, and smoking. Lastly, what comes next after a heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve quality of life and longevity. Devices like biventricular pacemaker, implantable cardiovascular defibrillator, and heart valve repair or replacement. And the last resort treatment option is heart transplant. The lifetime risk of heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.